Apoorva. Thank you so much, Nupur. Thanks, AV guys, for setting up my laptop. It was a little last minute. Thank you, Yossi, for this opportunity. I'm going to be presenting about acing residency exams with special emphasis on acing. So, if you're looking for something that is okay, if you're looking for something to pass exams, maybe this presentation will be a little too much, but I would recommend that everyone does their best in residency exams, because it is some indicator of how you have done your residency and how you've prepared for real life as an ophthalmologist. So the aim of residency is to be a good pan-ophthalmologist, know everything about everything, which is an ideal situation, but know something about everything, which is more practical. Acing the residency exams is something everybody should aspire to. Ideally, you should get a gold medal, but practically do your best in the exams. Don't make blunders. That is one of the aim of exams. Make lifelong friends and contacts, even with your professors. The problems unique to ophthalmology residency is that the exposure is very less in UG. All of us read a lot of medicine, surgery, OBGYN, but ophthalmology is very alien. There are a lot of gadgets, ophthalmoscope, slit lamp, gonioscopy, 90D, doing lasers through those lenses. So it's like looking into like looking into a hole with entire new optics, and it takes a while to even start looking at the disc. Then there is surgery. It is microscopic and needs a lot of hand-eye coordination, binocularity, stereopsis. There's the issue of the posterior capsule being only 4 microns and so much learning curve. And ophthalmology is extremely vast. As a resident, exams acquire new meaning. It's no longer like 10th standard, 12th standard, right? It's not about that. Residency is real life. It's no longer about marks. And what are exams anyway? It's just feedback, correct? It is just that on that particular day how you did. So it is ultimately just feedback. Actually, throughout 3 years, you are being examined, and that internal examination is happening based on sincerity, punctuality, seriousness, your approach to patients, how courteous and polite we are. And mind you, you're being judged and being examined by the staff, by your nursing orderlies, by patients, patient relatives. And well begun is half done. So why am I talking about so much is the acing of exams, residency exams starts from day one. What you put efforts from day one. Enthusiasm to learn should be there from day one. And every posting, every subspecialty posting is an opportunity to explore each specialty in depth. And there are a lot of temptations in residency. I know my co-residents who used to party every week, but then they were very high performing residents. So they were very good, and maybe they got away with partying every week. But we have to resist the temptations. Like Ayushi said, it's about discipline. So you have to put in disciplined efforts every day. Anything that can rejuvenate in a short time, like a book or something, should be preferred over long periods of relaxation. Read something every day. This is something I tell all DNB residents, that every day you should cover some topic. Like you saw giant papillary conjunctivitis today, go and read about it. It will take you 5 minutes, but that goes a long way because you've seen the case, you've read about it. You saw pigment dispersion syndrome, go and read about it. It takes very little time if you think about it because you saw the case already. Teach your juniors. My seniors used to launch into impromptu lectures like my सुन मैं तेरे को नैनोफ्थाल्मस पढ़ाती हूँ सुन मैंने कल पढ़ा था मैं पढ़ा देती हूँ तुमको so the impromptu lectures used to start and I was like okay 1 second and they used to just start off with statistics and this and that and you have to carry on that tradition. That's something I do still. Present cases to SRs. This is a very important thing I want to talk about not restricting your reading. No, there is this thing like you open Jacobi or you open Ryan for retina and people are like, even your seniors, वो क्यों पढ़ रहे हो इतना सब कुछ मत पढ़ो. No, it's not that. The biggest books have the most lucid language, and you will understand the most from the biggest books because they have put in years of effort into learning and understanding and publishing. Those books are published by mega stars in ophthalmology, and it's a pleasure to read them, and that's where you will learn the most. You read what you grasp from. I don't want to name any names, but there are books which you know, tell about just enough to pass exams. This is a gold mine, that is basic and clinical sciences by AO. It's the PDFs are pirated versions, of course, are freely available. You know, have the sources. I don't have to tell you. These are gold mines, and these are the books you should read and study from, and not some senior seminar notes or something. And then what I did was make notes from everywhere and then concise them and paste it on my Kansky for last minute revision. My Kansky was this thick at the end because it had all my notes inside the book. And there are these beauties called review articles, which are great to understand every topic in detail. Don't come to a class. Coming blank to a class is a complete waste of time. Whoever is presenting on that particular day, ask them the best source, what the topic is best understood from, and ask questions in the class. How many of us know what is the format of our theory exam and practical exam? Know this well in advance, because there are some high yield questions, 10-mark questions, 5-mark questions. You need to know 10 marks answers for radiation retinopathy. So if you don't end up reading radiation retinopathy, there's no point. And then there are different basic sciences we neglect until the last 1 week, but that should not be done. You should read a lot of anat physio optics. There is distribution of practical marks. How many cases of external and how many fundus cases are you getting? How many stations in OSCE? What about instruments? So you should know about this very early on in residency in order to ace exams. So during the rounds, you have to be very tuned in, know everything about every patient, and whether you're correct or not, you have to talk on rounds. If they ask you a question, at least tell what you know. So you might shout out the wrong answers sometimes, but be confident. It's all right, because it's not exams, it's still just rounds. You have to read and come every day. If a teacher has asked you something today, like I ask, what is PCV today? And next day I ask you, did you read about PCV? Don't say no, you didn't. That's one thing you can do for your mentor who wants to teach. So read and come and discuss. The mentors will love you. Every teacher will love you and call you and teach you and ask you how you're doing. It's personal experience. You have to be very interested in cases. Every posting you have to learn slit lamp, gonio, applanation. These are the things you need to do in a couple of seconds in the exam. So how will you ace exams if you can't do a gonio in 30 seconds, if you can't do a retinoscopy in maybe 1.5, 2 minutes, even complex retinoscopies, even IDO should not take you more than 3 to 4 minutes. So acing exams means, learning to do them by doing hundreds of them. So this is a surgical logbook. It's not pretty, like Sonal said, hers was not either. So I am relieved. Then I don't know why my slide looks like this. It shows all your successes and failures. And mind you, in my post-MS DNB exam, in the MS exam, they never used to ask for logbook, but I had them anyway. And in my post-MS DNB exam, they asked for a logbook and I showed them. And they were very amused by my logbook, but at the same time, gave me credit for having it in the first place. Make note of, coincidentally, Ruchi Goel ma'am was my mentor as well, my research mentor. She taught me, she gave me my first assignments for publications. She was my first co-author for a lot of publications. You have to attend meetings and conferences. This helps you ace exams. Why? Because like I said, very obscure topics like spasmus nutans was a 5-mark question, and I remembered spasmus nutans. I was the only one who knew the triad because I had attended some PG training module which CFS used to make, and they had discussed a case of spasmus mutans. It's like about the visual impression. And give your FIC or FRCS exams during the residency. Give step 1, 2, even 3 if possible, because they are levelers. They are very standardized exams, and you will not learn these things from a book. So it's going to be helpful if you volunteer for a senior batches exam. Go for mock exams like I2I at our place in MM Joshi, iFocus. Towards the exam, I'll just take 1 more minute, sorry. Towards the exam, start stratifying what you know, what needs revision, what is not known. Don't have any unfinished syllabus. And this is not the age or the time to study one night before the exam. We are old now. We can't do that anymore. I think many of us agree. So don't study after 9 o'clock. Eat a balanced meal. I remember my seniors, there was an epidemic of taking Zolpidem previous night and they overslept. Imagine the horror. So don't do all that. Sleep for 7, 8 hours. Then have some shortcuts. Like look at this resident of mine making these crisp flow charts, clear sentences, avoiding cancelling out, making small, neat diagrams for everything. Such a neat paper, such a pleasure to read. These are the papers you want to donate, just keep giving marks. So, like I said before, don't take anti anxiety, sleep medication, don't do anything out of routine. I'll tell you one thing, my co resident, he went at 3 a.m. in the morning of the exam thinking he's not able to sleep. Guys, he got stabbed by a group of robbers who were trying to jack a car. So don't do anything out of normal. Just stay inside, stay safe. He missed his exam. He got stabbed on the day of exam. Can you imagine? So make a checklist of every likely case. Don't try to find out which case is there. Just know what type of cases can come. And if you say something wrong, don't panic. You just move on to something else by saying I don't know. You can make up in the rest. And when the exams are over, please celebrate. You were very focused throughout residency. You did your best, and exams are just a blip in the larger scheme of things. You can do a fellowship, have so many publications, be a speaker at conferences. Don't think of exams and how you did in them, because life is long. So
Congratulations for completing this excellent presentation. It was so thorough. It has completed almost entirety of what you should do to be acing your exams. And just one quick comment that I wanted to make was that so when you are a resident and you are preparing for your exams, the exam is a theory exam and then a practical. So the theory, you last wrote your theory when you were a final year MBBS student.
yeah.
After that, you have been writing prescriptions and your self notes. It has never been timed. So if the papers are lengthy sometimes, and 10 question pattern has now creeped into the MSA also. So she's right, all that you have to be thorough with all the topics that you have not read and everything. But at the end, you also have to practice that whether you're able to write all of that you know in the 3 hours. So it is like read, retain, revise and reproduce. So that reproduce in the 3 hour in the format in the best possible way, that when the examiner reads it, it is going to impress him and give the good marks. So that is very important. And also when you are preparing for your viva voce, I agree that yes, you should look at your seniors pattern, but don't be only guided by it, because one thing that happened with us was the seniors exam was much simpler, and we came to know our exam, the MNC, not the NMC now, at that time it was MCI check inspector is also coming to see the exam. The examiner was changed, suddenly a new examiner was there, was not there in last previous 2 exams, and all sorts of things were happening. Just we came to know all of that in the 3 days prior to our exam. So don't prepare just the way your seniors have prepared. Take a few extra steps also.
True.
Anything
Prepare
else?
for the worst.
Yes, prepare for the worst. Anything else any of the panelists would like to add?
So thank you, Dr. Apoorva.